Good morning and welcome to KGUA in Molalla 88.3 FM. I'm Leigh Anne Lindsey, your host today, and we are also on YouTube this morning with a guest that is waiting on Zoom for us, and that is Dr. Andy Coren of the Mendocino County Public Health Department. And we'll be talking with him in just a moment. We need to get into some of our events first. And I wanted to let you know that I do have a podcast I'm producing called It's All That. And I'll be focusing on health, technology, and events, travel, and of course, horses. And that's going to be coming up later this year, but I'm going to be taking a lot of the radio shows that I do and creating that and distributing it across all types of podcast platforms. And I'm also a documentary film producer working on Seabiscuit's legacy, Healing with Horses. And if you'd like to make a donation to our production, you can go to the seabiscuitheritage.org and click support. That's the Seabiscuit Heritage Foundation. And as far as our events go in Point Arena, we've got the farmers market today at Friday. I keep thinking it's Friday because normally I'm on Fridays, but it is Wednesday, July the 19th. So coming up this Friday is the Point Arena's farmers market at 3 to 6 p.m. And then the Wallala Farmers Market is Saturday from 9:30 to 12:30. There is an interesting hike along the Garcia estuary in the tidal marsh and riparian areas, the wetlands there. And that is going to be Saturday, July the 22nd from 10 a.m. to 2 p.m. And they are requiring reservations. You go to the sponsor of the event, their website. It's the Dorothea King Young chapter of the California Native Plant Society. And the address is DKY for Dorothy King Young, and then cnps.org activities page. Or you can call up the Point Arena Lighthouse and talk to Mark or whoever answers the phone and find out more about that. But again, it's Saturday from 10 a.m. to 2 p.m. And the Wallala Art Center has several great things going on. Last Friday, art inspired by coastal Chile opened at the Wallala Arts, and that's ongoing. And they're also still showcasing the history and use of cannabis in Mendocino County. And there are 3 different art centers that are working together to showcase this history. And that is the art centers of Ukiah, Willits, and here in Wallala. The music of Miles Davis and Eric Jacobson is also playing Saturday at Wallala Art Center at 4 p.m. Call the Art Center at 884-1138 to get more information about that. And I believe that the last thing that we wanted to, there's 2 more things. The Timber Cove is having a 60th anniversary celebration, and they're doing some special getaway rates. So if you'd like to have a mini staycation, you can find out what they've got going on. Point Arena Theater has a very interesting new short film festival that they are going to be holding November 10th and 11th. So they're looking for local filmmakers to participate by sending in short films up to 20 minutes. And I might participate in that. We'll see. I have a lot of work on my hands. But anyway, that's for all the local filmmakers, and contact Arena Theater about that. And then I believe that is it, so that we can now move on into our morning show with the Mendocino County Public Health Department. And we have with us a very special guest who has an update for us, and that's the Mendocino Public Health Department's own Dr. Andy Coren. Good morning, Dr. Coren.
Good morning to you. Boy, I love all those announcements. I'm thinking about moving over to the coast, except I like the sun so much. But wow, what you have going on, it's terrific for the community.
I know people sometimes will ask me if I'm in Santa Rosa or San Francisco or somewhere, well, what do you do up there on that coast? And I said, there's plenty. We've got
it's terrific.
Right. So good morning, and thank you for coming back on and giving us an update. I know you've got lots of things to share about RSV and COVID, and also the heat-related events inland, but also we have to be careful here on the coast as well.
That's true. Well, I thought since I for the last 3 years been the COVID officer, more than the health officer. Then I
Designated.
would start with a COVID update, if that's okay with you.
That's fine.
And then, do you also get phone calls in with questions?
No, we don't, because
Okay.
we're all volunteers and I'm the chief engineer, host, and operator today. I'm the only one here.
And the bottle washer, as they say. All right. Well, let me just dive right in. And if you have questions, of course, interrupt me and I'll, answer whatever I can. You probably know what questions have come up locally from the coast, and that's good for me. So at this point for COVID, we have had several months with many fewer cases, hospitalizations, and deaths. And that's confirmed all over California and even all over the United States. Here locally, we do have two wastewater surveillance sites, which are new this year rather than last year, and they offer the best early detection. And so we have a good sense of what's going on. We have two of them here in Mendocino County, and they are both showing very low levels as well. The testing, of course, is very low because it's not required and not encouraged very much. It's mostly coming from the hospitals, and the test positivity is 3.9%, still pretty low compared to what it had been during the high points of the epidemic. Hospitalization admissions are low.
That's really
As of last week, we're running an average of 1 to 2 hospitalizations at any one time due to COVID. And of course, we used to think a lot about, well, do we have ICU beds available? And yes, we do. That's not an issue. The number of people that Mendocino County has lost to COVID remains at 146 deaths. There's been no recent changes, and there are no outbreaks at this point. So in the future, we're expecting the virus to behave like a yearly cold virus, like flu and those kinds of things. We don't exactly know when it'll peak. We don't ever know when it'll peak, and we don't have enough time to gather that information now. But we do want to encourage everyone to get vaccinated. There is a new mRNA vaccine, and it's going to be it's not out yet, but it's going to be based on the recent variants and should be much more specifically targeted. The bivalent vaccine is still around, and for people who haven't had a booster in the last few months or haven't had any, one bivalent vaccine would be worthwhile. And then when the new vaccine comes in, you can get that. At the same time as the new vaccine for COVID is being distributed, people can also get the new flu vaccine. So you get two vaccines in the same doctor's appointment. Now, you mentioned the RSV vaccine, and that should be out and available. It's recommended for people who are over 65 years old and people who are immune compromised. It's not at this point safe to give them both at the same time. I don't mean that it's unsafe, but it'll decrease the efficacy of one or the other of them. So it hasn't been proven. So you'd have to have an appointment for the flu and COVID vaccine and a separate appointment for the RSV vaccine. Okay. It usually takes years to combine those to make sure that they're compatible and that sort of thing. And I think it would be important to use the usual advice is to be vaccinated, and when the numbers go up, or even not, if you are at higher risk or you live with a person who's at higher risk, identify people with those risk factors, and if it applies, then do wear a mask in crowded indoor spaces. So that's not gone. And of course, the same recommendations are: if you're sick, get tested, don't go to work to spread it around. And if you do have COVID, there's very effective medications for it that are available through your providers. So that's the COVID. I just want to say,
go on. I do have a can you talk to the effects of long-term COVID, as far as because I have some people I know that are still affected by long-term COVID effects. So what's the help that's offered out there for those kind of people?
Well, for one thing, the symptom complex is pretty general, and it needs to be diagnosed. The COVID symptoms usually for most people are gone within a month to 3 months. We start calling it long COVID when it's over 6 months. It can last a year, and in some people even longer than that. And of course, the symptoms are things like fuzzy headedness, terrible fatigue, sometimes muscle aches and pains, and intermittent fevers. And there's nothing new in terms of treatment. The vaccines don't seem to shorten the course of them as much as it's been studied. But vaccines prevent the acquisition of long-term COVID because it prevents, the infection fairly effectively.
Okay, good. That's really what I wanted to cover.
Yeah. There is more research going on. It's a newly discovered diagnosis, but the research institutions are taking it very seriously, and hopefully we'll get some more information soon.
Because I've heard some people talking about memory loss, effects on the heart.
Yes.
And how to really determine if it was related to COVID in the first place, or if it was connected to something else, and how they could get treatment for those things.
Well, the main thing is to go to their primary physician to rule out other things which may be treatable. That's one of the issues, because COVID right now, long COVID, does not have a specific treatment. But there's at the university research centers, they are publishing long lists of other illnesses to make sure you rule out, which most doctors know how to do. And if your symptoms are due to one of these other illnesses, there's a good chance that that's treatable and you can feel better. And if it's not, then long COVID is at this point a diagnosis of exclusion. Of course, they would check to see if you have had the illness in the past, and some people have had it and don't even remember having it. They were asymptomatic, and yet they have long COVID, and that's what we wind up with as a probable diagnosis.
That's interesting. They didn't even know they had it in the first place, but they could have long-term effects from it.
Right. Clearly, the most common, more severe long COVID comes from people who had a more severe early COVID. But it's not exclusive of those people who had mild COVID or even asymptomatic COVID.
I was one of those in the early days, December of 2019 into January of 2020. And back then they were calling it flu type B with bronchitis, a site of bronchitis. And, I wondered if even some of my own heart issues resulted like a year later. So I don't know if it was associated with that or something entirely different, but I am having my primary care doctor and cardiologist and all that follow through with those things.
Yeah,
but I've read about it. I've heard about it from others.
Yeah, that's the key thing. And, uncovering that long COVID and validating it and now doing the research on it is taking longer than any of us want. But that's how medical science proceeds, slowly and carefully. And I think we just have to bear with that.
Well, if you're just tuning in, you're listening to Dr. Andrew Coren. He is the chief or head of the Mendocino County Public Health Department. You can correct me, Dr. Coren.
I'm the health officer.
Health officer. Thank you very much. And you're listening to KGUA in Wallala 88.3 FM. We are streaming online at kgua.org. We're live on YouTube right now, so you can watch the show anytime and get caught up on the health updates that Dr. Coren is giving us. I'm Leigh Anne Lindsey, your host today, as Peggy had to be out. And I'm happy to be here as one of the volunteers. And of course, this is our fundraising drive time. So we need the money to keep the lights on, to do important interviews and updates like this one today with Dr. Coren. So Dr. Coren, you were just about to go into another set of your talking points and I interrupted you with some questions.
No, that's fine. Not an interruption at all. Let me just go over, because there's been so many questions, and in the last year, just rolling out vaccines, there was primary series and boosters and third shots and fourth shots and that sort of thing.
Yep.
At this point, the new bivalent vaccine is available at pharmacies and at most of the federal qualified and rural health clinics. And in Mendocino County, 69% have had the primary series. Only about 50% of people over 65 years old have had the boosters. And so they still can get some more. The current recommendation for everyone over 5 years old is to only have one of the mRNA bivalent vaccines. Whether you've had a whole series or whether you've had none before, one bivalent vaccine is what's recommended at this point. I mentioned that. And when the new vaccine comes out, which will be monovalent, it'll only be against one of the variants, but it'll be the one that's the most commonly circulating at this point. That'll also be only one that's needed. Now, for people younger than 6, they will need to check in with their primary care provider or one of the health clinics, one of the public health clinics, because younger than 6 may need 2 or 3 vaccines to be thoroughly vaccinated. And that's, it depends on whether it's Moderna or Pfizer and the age and their prior experience and that sort of thing. And people who are over 65 are still eligible for a booster. Novavax, which is not mRNA technology, is still a 2-dose primary series, but you can follow that with an mRNA booster as well. So just to let you know, that's the vaccine situation.
Good to know, because I think a number of people kind of fell off after a time, including myself, I'm afraid to say, where we got the original boosters and all of that, and then suddenly we just kind of stopped doing it. So I need to get back in and get my own updates done too.
Yeah. It's not an uncommon experience. We want to keep people vigilant, and especially now, it's plenty of time before the fall season rolls around. I think a lot of frustration came out because there were changes in recommendations, how many you could get, whether you could have a booster, what age,
Right.
what your condition was. And it was just a lot of things for people to keep in mind, and it got frustrating. It's getting more simple now that we are getting this more under control. So that's a good thing.
So your primary care doctor will be able to step you through this because they know
Right.
your health and your history.
Yeah, and the public health clinics now has opened to give flu vaccines, COVID, and some others. And we are open on the coast for a half a day in Fort Bragg on Mondays, and then another half a day in Willits, and Tuesday through Thursday here in Ukiah, the public health clinic is open for vaccines. So any of the FQHCs or public health clinics can give advice and usually administer the right shots at the right time.
Is there a number that they can call to find out more or to schedule an appointment if they need to?
Well, the call center number for the Department of Public Health is 707-472-2759. 707-472-2759.
Great. We'll make sure to amend that too.
That should do it.
Great. Okay, so once we've been able to get these update shots, especially before the fall and winter season, when, typical flu activity ramps back up, what should people be planning for as we head into that time frame?
Well, we want to protect ourselves as usual, increasing, if you can now, the ventilation in your homes or your businesses. That's very useful. And then there aren't requirements, but there are strong recommendations to get vaccinated. And then if you're sick, stay home and get tested. And if you test positive, get the Paxlovid treatment, which is an antibiotic. It's a short course, but it's very, very effective. And it does show that it decreases not only the illness, but the risk of the long-term long COVID.
Right.
So that's good.
You mentioned, I know this is a little off topic, but you mentioned opening your windows and getting fresh air. And I have been hearing reports of inland Mendocino County and Sonoma County even experiencing some of the smoke from the fire in the Sierras, as well as maybe some from Oregon. Is that, can you talk about any of that issue?
We're getting some smoke. The air quality index is still pretty good, at least here in Ukiah. But that's always something you have to take into consideration and weigh the pros and cons. When we talk about ventilation, we're usually, increasing ventilation. We are usually talking about HVAC systems in businesses and institutions. But it's true, opening the windows and doors really does help. And now the other environmental issue that we would be concerned about is the heat. So heat, if you have air conditioning, then you want to be using that, not with the windows open. If you use a fan, and that can be done, you don't want to bring the hot air in. You'd want to make the fan blow out. And certainly if you're using it in a closed area, you don't want to blow it from one person to another. But ventilation is very good for these winter viruses. So that's just something to put in people's minds. And then, there are not at this point going to be, we know of, requirements for closures or requirements for masking and those kinds of things. Individual businesses and institutions, nursing homes, hospitals may have their own requirements, but the state, and at least my consideration right now, is not to impose mandates. We're looking at the possibility of, in hospitals, nursing homes, we've had in the past for influenza requirements for the employees to either vaccinate or mask, and that is still a local, it's not a state or federal requirement at this point. We'll have to see what Cal OSHA requires still. But those are the recommendations. Then, of course, if you're sick, don't take it for granted. Oh, it's just a cold. It could be something more serious, and you could spread it around, especially if you're more vulnerable, you could get more ill, or you could spread it to a more vulnerable elder or someone who's on medications to decrease their immune capacity, like people who are on cancer therapy, things like that. So those are the general recommendations going into this next season. This season, we're dealing with heat. And boy, do we know it.
You are inland. Yep. Even on the coast, it was getting warm for us.
Yeah.
And it looks like it'll get warm again on Friday, back up higher.
And I want to put it in perspective as we get into this. This heat is definitely because of climate change. We're seeing more and more of it, and it's more frequent and higher. They've had record temperatures all along the South and the South, even Southern California. You've probably heard of the incredible record temperatures in Death Valley.
Yes, we have.
And here, even in Mendocino County and Sonoma County, we're seeing evidence of illness due to climate change and heat. There have been significantly more emergency room visits and ambulance rides because of heat illness, either heat exhaustion or heat stroke. And it's notable that heat kills more than any other climate event, even more than hurricanes and floods and fires. But it does it in a way that's silent and for over a long period of time. And you don't see a lot of it. It's really underestimated because it can happen in the form of a heart attack or a stroke or other illnesses getting worse. In the United States, it's estimated that 60 deaths per year, or in California, 60 deaths per year have been documented as a result of climate change, as a result of heat, and 5,000 additional visits in the emergency room each year in California. It doesn't sound like a lot. But again, the increase overall in these visits for heart attacks and strokes and so on is something that we're going to begin to be looking at by collecting that data statewide. And these are the highest numbers in really thousands of years for the temperatures and so forth.
Well, I was relating to you earlier just on the phone about how even on the coast, when it's cool here yesterday, we had a complete fog cover when I went out to ride my horse with a friend, and we were only out about an hour. But the exercise alone and the activities, of course, working with the horse in the round pen before we got on even. So there was actually an hour and a half of exercise time. And I ended up not drinking water afterwards, I had some errands to run. And then suddenly I found out by going to the urgent care that I had dehydrated myself.
Right.
Even in that cool weather, and it was stressing my heart, and it was causing it to race rapidly, and I wasn't sure if it was an AFib or not. And I've had a flutter before, and it landed me in the hospital. So I'm extra careful now. So I went directly to RCMS to find out what was going on. And after they'd hooked me up and checked everything out, it was because I had dehydrated myself. And
Right.
how can I even do that when it's cold? But think about how much worse it is when you're inland or when it's hotter and you aren't paying attention to,
Right.
keeping hydrated, how much
Right.
you stress yourself. So very important.
So we recommend that people drink on a regular basis, whether they're thirsty or not, especially if you're going out and you're doing some exercise. So that's probably where, you fell down, is you didn't say, oh, I need to have a good drink every hour at least. And if it's hotter, even more. We use the heat risk index, which you can get online on your iPhone. People ask, well, when do you open cooling centers? And it's when the heat risk index is in one of the top two tiers. It's either very dangerous or it's extremely dangerous. And when the heat doesn't go down for 3 days, even overnight, to less than 70, because the overnight really helps people.
I heard about people like in Phoenix where it was 100 degrees at the coolest. And they were talking about how even their water, when they turned it on, was hot,
Right.
and that their bodies couldn't cool down enough because of everything else that it affects.
Yeah, it's very important. We're going through a very severe time. And of course, the heat is terrible in many parts of the world, all parts of the world in the Northern Hemisphere, pretty much.
So they go to this heat risk index and find out where they are.
Yes.
Does it do it by location then?
Yes. So the heat risk index is not just temperature. It looks at temperature as well as humidity, some wind speeds, because the breezes can help. And it also looks, interestingly enough, in different areas, the time of the year, it factors it in. The reason for that is because we get acclimated to the heat, but at different times in different areas based on the season and what our ambient temperature usually is. So it takes all of that into consideration, and then it gives it a score. And so we may have been significantly different than it was down in Central California or Southern California. And those are all the issues that we need to take into consideration. It's not just the thermometer, but if your thermometer is kind of high, but it's very humid, or there's no breeze and it's early in the season, it can be a very high heat risk index. The risk can be very high. So we look at that.
Yeah, a lot of people got used to they were not used to it, but it was unfamiliar to have it be so cool earlier this year for the summer. And then suddenly it's hot and everybody wants to get out and do activities. I've
Right.
seen people running and biking and even here on the coast. So it's happening inland with a lot of people getting out to the parks and such. So
yeah, so people who do heavy work, and we advise really to avoid heavy work, sports, workouts if possible, or do them before 10 a.m. It's interesting that the highest risk of death is in people between 25 and 64 years of age who are working or playing outside. And that's the age group where more people work and there's more sports in those groups.
And we've got a lot of vineyards in this county.
Exactly. It's very often agricultural workers and minorities who have to work there. Those are some of the differences. We want frequent breaks. Cal OSHA requires regular breaks, shade, and water available to people. And you really want to avoid work and being outside as much as possible between 10 a.m. and 6 p.m., which is the highest, when the sun is the highest and the heat is the highest. And then, like I said, drink even if you're not thirsty. And drink does not mean alcohol. Alcohol helps dehydrate you. It doesn't really hydrate you. And so people who are drinking, it's a big problem. Drinking alcohol is a big problem. And then watch out for heat.
Those cold brews they may cool you down a little bit when you drink it, but they're actually dehydrating you.
That's right. And then watch out for heat symptoms. It can be heat exhaustion, or it can be heat stroke in yourself and families, friends, neighbors. Remember, not only alcohol, but medications increase vulnerability. Some medications like water pills, diuretics, things like that can increase the risk.
And what are some of the signs and symptoms?
So, when you're heat exhausted, you're weak, you can be dizzy, not usually dizzy, but weak. Usually you'll be clammy and wet skin. You get muscle aches and cramps, even headaches. Heat stroke is when your body can no longer cool itself with sweating. And so the skin tends to be dry and red, and the pulse is very thready. Like you said, even with heat exhaustion, it can be rapid. But when you're with heat stroke, it can be irregular as well as rapid, but it can be hard to pick up because you're dehydrated already. So be careful when it gets worse. When it is worse and you have some of those symptoms, it's call 911, go to your urgent care center, emergency room like you did. It's too dangerous to take that risk.
And 911 along our coast and inland, they're very responsive, and they've always reassured us to please call them. Don't think that you could handle it on your own. That's
Right.
what they're here for. They're here to help, even if it's just to come over and check your vitals. And
Right.
even if you don't need to get into an ambulance or anything, they're here to help.
Correct.
And so now, did you want to talk any more about the heat, or did you want to talk we talked about air quality. I wanted to know about water quality here in the county, with any algae blooms when it gets warmer, and then also the tick situation.
Yeah.
Here.
So
Our
the
area.
water quality is not as affected right now. I think there still are restrictions on fishing, mollusks, and some of those that take in the algae more and can be more toxic. But I haven't heard of water quality issues at this point.
Good.
When there is a problem along the beaches and some of the rivers, our environmental health people post signs. So look out for the signs. But I think that risk happened earlier and is over. The other thing that we want to talk about, and we'll get to the mosquitoes and ticks in a minute, as long as we're on heat and everybody wants to get out and swim. Let's just go through the risk of swimming, which is drowning. And that is something on the coast that we do need to worry about because of currents, sneaker waves we know about. And also, since the floods and letting out more water from the dams is a little erratic, there can be currents in the rivers that are unexpected. The CDC says the number one accidental cause of death in children 1 to 4 years old is drowning. And it's in those who are 5 years old to 14 years old. The risk of drowning death is second only to motor vehicle accidents. So motor vehicle accidents in that age group is a cause of death, number one. And then number two is drowning. And so we've already seen this in Mendocino County, where a 5-year-old was swept away by the river earlier this year. And in this year so far in Northern California, 22 drowned since mid-April. These are huge numbers.
Significant. Yes.
Yeah, I think some of the younger ones are kind of close to their parents who are looking, but too far away to really rescue them. That's one of the most important things, is to really closely supervise the little children. Little children can also drown in, as many people say, in 6 inches in a little, swimming pool in the backyard. So you really need to be close in your supervision. And for older children and adults, the buddy system is still something that's recommended. You want to be close to a buddy who can see when you have trouble and can help. The risks of people drowning is more in boys and girls. Native American and Native Americans are highest, and Blacks. People with seizures and other medical problems have significant risk for drowning. And again, in natural waters, lakes, rivers, and oceans, it's more older children. And the younger children get into trouble even in residential pools and those little plastic blow-up pools. That's where children get. And they want you to fence around any pools you have on your property, not just fence the property, because then children can get out from like the back door and go play in the pool and you're not there. You want to fence the pool. The other things to do for children is teach swimming and water safety as early as possible. Formal classes are the best. And you want to teach everyone not to dive in shallow or unknown depth water, because there's a lot of people who die from broken necks. Let's see, close supervision we talked about, buddies.
So the coast, one thing besides the sneaker waves, we have riptides.
Right.
And I used to abalone dive off of this coast when I was in my early 20s and up at Van Dam. And I was up at Van Dam once and got caught in a riptide and started headed down the coast, you
Right.
know, and I was with a buddy and we both just kept angling ourselves into the coast as we could. And eventually, we were able to get out, but it happens here on the coast and people aren't quite ready for something like that. And
Right.
in the mountains, because we've had all the snow, now there's all this melting snow that's coming down and causing the rivers to be much faster and more aggressive. And people don't realize how much, if they could get in that current, they could be swept away quickly.
Right. That's exactly right. The
So
other thing to keep in mind is boating. And for children, we always encourage life jackets, but in boating, life jackets are well worthwhile. I know they're a pain in the neck, but they very much do their best. And 83% of deaths in boating accidents, people have not been wearing life jackets. And so life jackets they really save lives.
Well, if you are just tuning in again, you're listening to Dr. Andrew Coren. He's the health officer with the Mendocino County Public Health Department in the inland area of Ukiah and Willits area. He's telling us about some events that are happening in not only that area, but also Fort Bragg and along here on our coast. I'm Leigh Anne Lindsey, your host today. This is KGUA in Wallala, 88.3 FM. We are streaming anytime that you've got internet. You can listen online at kgua.org. This show is being taped on YouTube as well. We're live right now, but you can catch it up later and find out more about this update with Dr. Coren. And we are going to get back into it now and continue on with this update that we're so thankful to get from you, Dr. Coren.
Well, I'll move on to another summer, spring phenomena that we don't like, and that's mosquitoes and ticks.
Oh, I know, especially with our animals too.
Right. And so they're not only annoying, but they're vectors for more serious diseases.
Yes.
So, for example, ticks, we know about Lyme's disease for the most part, but there's also relapsing fever, paralysis, Rocky Mountain spotted fever, babesiosis, tularemia, and more that we haven't heard of, but they're there and the ticks can carry them. And so when and we want to talk about mosquitoes also, which are annoying, but they also cause, and listen to all these, malaria, which has come back within the United States. There were 2 cases recently reported where people were not traveling. Usually malaria cases in the United States have been reported from people returning from travel to the tropics. These 2 had no contact with the tropics. And so this was United States based. And of course, that one causes anemia and death. It's one of the world's #1 infectious disease killer. Mosquitoes also cause, you probably heard recently, a West Nile virus, Zika virus, dengue, chikungunya, St. Louis encephalitis. These things are very severe illnesses and they can cause meningitis and unconsciousness. Of course, they can cause the usual viral syndromes. Rarely death, but a lot of very serious illness.
I had spinal meningitis before, and it was serious. I died from that.
Yeah.
So how do people know when they've been bitten that they need to be seen? Just symptoms.
Well, let's first start with what do you do to prevent? Prevention is worth a pound a cure, right?
Right.
So when you're outside and it's for the ticks, we really recommend wearing long, light, airy clothes, but long sleeves and long pants. And some will and tuck the shirts into the pants, and even some people will make sure that the ankles and the wrists have either rubber bands around them, but they're closable so that the ticks can't crawl up in them. And then when you come home, check yourself. In fact, many will recommend removing all of your clothes and taking a shower, because some you can feel, they feel like a little bump to begin with, but they can grow. And if you feel them, you can take them out. You take these ticks out with the tweezers. and you just put the tweezers right close to the skin, even depress it a little bit and pull it straight out. All these other ideas about burning the backside with a cigarette or putting oil on it, they don't work. The tick does need to be attached at this point for 24, 36 hours to transmit Lyme's. And then the symptoms that you'd look for would be a rash. Now, a lot of rashes can happen that are not Lyme's disease. Lyme's disease has a classic rash of the target and so on and so forth, but that target rash could not necessarily be where the tick bit you. So you look for an unusual, like red and then pale and then red target type of rash, but it could be any other kind of rash. It could be just a spotted rash as well. So if you have a spotted rash in the first 4 or 5 days after being bitten by a tick, or headache, pains in your joints and muscles, fatigue, facial paralysis, a droopy face, is another classic symptom. And those kind of things should be reported to a provider. You can be tested. If you do pull out the tick could be tested as well. And then these are treatable. This is not, we hear about, and we have heard a lot about chronic Lyme disease, very, very unusual. And even that can be treated with common antibiotics. It just requires medical attention. So rather than being frightened to death about these, just take precautions before you go out. And then when you come back, you get some effective antibiotic therapy if you have symptoms.
Also treat your animals with prevention.
Yes. Yeah.
Right?
I'm going to get to repellents. I'm going to get to repellents and stuff like that in a moment. Let's move on to mosquitoes. They are annoying. I mentioned all the horrible things they can cause. Eliminate standing water around your property as possible. There are larvicides that can be used, but you want to be careful using them, especially if you have, fish in your pond, that sort of thing. There's mosquito dunks, and actually fish themselves can eat up the mosquito larvae before they hatch. But eliminating standing water, little puddles that accumulate. You're watering your lawn, but there's a depression, and a little puddle is there for several hours, and the mosquitoes lay their eggs. And go ahead. I'm sorry.
Well, no, I was just going to say, at the equestrian center or wherever we have horses or cattle, we've got water out for them standing all the time. So we've noticed if we leave this one area alone too long, it gets filled up with mosquito larvae. So we keep, cleaning out those buckets and tanks with fresh water and getting rid of that. But you've got to have those for the animals.
Sure. Well, that would be a good place to put mosquito fish. You put fish right in the tanks and they'll eat up the larvae, as long as they don't get cooked. Depends on how big or small the tanks are. But if it's large enough for a small pond, the fish really do a job.
They're usually about this size. So
yeah, they may work. And then the mosquito dunks, but honestly, I don't know if they're toxic to horses or livestock. So that would be something to look into. That's just a little something that has it has another bacteria in it that actually eat up the larva. So mosquito dunks are worthwhile. You can buy that almost any outdoor garden store.
Okay. Pardon? Mosquito dunks.
Dunk, D-U-N-K. They've been around for a long time.
Okay.
Yeah. So that's standing water. Be aware of standing water to lower the risk of lots of mosquitoes. Then there are other things that people can do. So most that we use repellents don't kill, but there is a repellent that does kill called permethrin. It's an insecticide, but we don't put it on our bodies. We don't put it on, anywhere where there's cats or fish, but it goes on clothes, and it is organic. It stays on the clothes, oftentimes different preparations, even through washings. And it can apparently be put on dogs. I would look on the bottles of what you get. So it's permethrins, Pyrmethrin, and that's insecticidal. It kills the germs, and if they eat it, they die. Most of what we use are repellents, though, and that's where a lot of questions about how safe are they come in. These don't kill, but they smell terrible to the mosquitoes, and so they want to stay away. And there are repellents also for that are repellents for both ticks and mosquitoes. So the one you see most in preparations contain DEET, DEET. And that can be irritating to some people. There's questions about what kind of other symptoms can it cause. It's very effective. It is what the military has tested and prefers when they go into areas with mosquitoes. Another product is Picardin. Another that's Picardin. Another product is IR 3535, and I'm not even going to attempt to pronounce the chemical that represents. But there are products called OLE and PMD. Also, PMD is too hard for me to pronounce. You only want to use many of these in children over 3 years old, but there are some clip-ons that you can use. And there's also, don't forget, oil of lemon eucalyptus. That's the OLE, again, over 3-year-olds. And then there are natural repellents.
That's what I wanted to hear.
Yeah. Well, the oil.
I'm just concerned about all the chemicals, and there are some controversies over DEET and other things like that.
Absolutely. We all are. And that's why oil of lemon eucalyptus is reasonable. It's a natural product, but only for the older kids. PMD is not natural. The natural ones like citronella and the oils of cedar, geranium, peppermint, soybean oils, they may work. They haven't been formally tested and they're not registered. So that's the concern we have. You have to see how they work on you or your children, and they're considered to be safe, but again, they haven't been tested. And there's a lot of natural things can be unsafe.
Right.
Or you put it on and it can cause itching and irritation. Don't use that one. It's not for you.
Even my horse has very sensitive skin, so I have to be very careful what I put on him. And there's something that we do use called Equispot that is good to just put on little dot on them. And it seems to be okay with that sensitive skin. And I have cats too that sometimes go out into the yard. So there's prevention for small animals too.
Right. So some you can use in spots and there's not as much that you'd be applying and it might be, fine. I'm not the expert on that. So reading labels, talking to the people in the store who know, or your vets, people who have horses have their own veterinarians, and that would be
Yes, we are fortunate to have Kendall Wilson, who comes out from Ukiah. Yeah, and she brings always someone to help her too, but we line up the horses for her to treat. But that is important if anybody has animals or small children, and to pay attention to the age of the children and what you're treating with. Really do the research, talk to experts if you can, talk to your doctors, right? And just wanted to point out to everybody that's listening, this is Dr. Andy Coren. He's the health officer with the Mendocino County Public Health Department. And it's their job to be watching over all the health issues that our residents might be encountering. And we're very fortunate to have Dr. Coren on today here at KGUA in Wallala, which is the southern tip of Mendocino County on the coast, Sonoma County right across the bridge. But we are here talking today about the things that are of importance to us as far as COVID, RSV, the air quality, the water quality, and ticks and mosquitoes, things that we need to know more about, not to be fearful of it, but just to know what solutions might be out there. And as a pilot, I was always trained for any accident that could happen. So you always just prepare and you make whatever you can to have as a solution. So that's what we're doing. And Dr. Coren, I'm sure you've got some more to share in these last few minutes of the show. We've got 10 more minutes. You can take whatever you'd like to address other issues.
We have covered pretty much all the terrible things that can happen to us. And I would just like to say, yes, it's summer and it's wonderful. And at least at this point, we don't have any peaks of contagious infectious diseases. We deal with that in the health department and we would know if there was outbreaks. We don't have any outbreaks. So enjoy the summer. Just do it safely. Be alongside those kids and around people. If they're swimming with life jackets and be within reaching distance for the little children. And then for the heat, drink, but not alcohol. Or if you're going to drink alcohol, make sure you're going to be indoors and in the shade and you're plenty hydrated with water, because alcohol does not hydrate you, it dehydrates you. And otherwise,
sodas too. People think that if they just drink a lot of sodas, that's going to help, but it really doesn't.
It's hard to put down as much soda as water. But it's not, and of course they can be very sugary, which we try not to have people, but diet sodas have not proven to be bad. It's just harder to put it down. So if you have some diet sodas, it's all right, even some regular sodas, but make sure you're having water.
Exactly.
And drink more on a schedule than just waiting. When you're waiting until you're thirsty, you're already a little dehydrated. And so we don't want to wait.
And after 3 years of a pandemic, it's nice to hear that the numbers have gone down and that there aren't any big mandates and things like that. There's still masking if you're sick or if you have health conditions. So we really appreciated that update, Dr. Coren.
Yeah, we want to stay well. Remember, an ounce of prevention is worth a pound of cure. And it certainly is worth a lot of orders. I do not like doing the orders, so it's only when it's absolutely necessary for the population.
Well, we're really thankful that you had the time to come on today and share this information with us. It's so important for us to be aware and to know what we can do. And you've helped us cover many topics today. And if anybody wants to hear this show again, it will repeat at 1:00 today on KGUA, so you can listen to it online too at kgua.org. And you can also go to our YouTube channel and watch the show if you'd like. I'm Leigh Anne Lindsey. Thanks for listening today. And thank you, Dr. Coren, for joining us.
Thank you. Have a great day.
All right. Have a great day inland. Bye-bye. And we're going to say goodbye to our audience on YouTube as well. Thanks for listening to KGUA in Wallala, totally